this is an observational study. And we present the baseline results. This study will be longer, and we have to evaluate more results in more time. The relation between activity of MS, clinical and radiological activity, is well known. Our study is in patients free of activity of the disease, without relapses, without new lesions in MRI, and without progression. Our theory is if higher levels of light chain neurofilaments in serum along the time could predict in the short term new inflammatory activity, and in long term could predict progression in our patients. We would like to know if subclinical or subradiological activity could detect in the future progression with levels of light chain neurofilaments in serum. And our results is are of the pilot study is baseline results. In our results are very similar in other studies with neurofilaments. We found in our patients, in the majority of our patients, the light chain neurofilaments were normal. We found all the patients presented higher levels of light chain neurofilaments, and patients with longer MS presented lower levels of light chain neurofilaments. We found higher levels of light chain neurofilaments in patients with less duration, with less time without activity of the disease, clinical and radiological disease. And we analyzed the results according to the different treatments in our patients, and we found patients with platform treatments presented higher levels of light chain neurofilaments if we compare with patients with high activity, high activity of the disease, against of the disease. These patients presented lower levels of light chain of neurofilaments. The first topic, I think we have to normalize these results because we didn't normalize these results with other factors which could change the levels of neurofilaments, like the age, and like other factors like how alcoholism could increase the levels of light chain neurofilaments. These results could be normalized. And I think that the implication of these results in the future, if we could assess this theory, is probably we must be more blunt in the treatment of the disease to prevent the progression. We have a small window of treatment, opportunity of treatment in our patients, and I think the main conclusion could be this in the future.